Hello everyone, my name is Stephanie Savage and I'm a critical care registered nurse. I have recently taken a part in a collegiate debate in health policy at UNC Wilmington regarding House Bill 780, End of Life Option Act. This bill proposes an alternative option for end-of-life care by offering qualified individuals with a terminal disease a prescription for a terminal comfort care drug. After thorough research, I have found that the best argument for this bill is patient autonomy. Patient autonomy should permit a qualified individual with a terminal illness the right to end-of-life options, including a dignified death. And the best argument I have found against this bill is do no harm, the Hippocratic Oath. Medical professionals are sworn to help people heal and are trusted individuals. Assisting suicide could potentially invite distrust in doctors and create a slippery slope. As of today, this bill resides in the first stage, called the introduction phase. So as of my stance, I believe that after weighing the pros and cons, I have decided to be in favor of this bill for two main reasons. My first talking point is full patient autonomy. As a nurse, it is our job to fully support our patients in their decisions about their bodies and their plan of care. With proper education, a qualified individual should have the right to a dignified death. To be qualified, this means they meet all the requirements mentally and physically to make informed decisions for themselves. For someone with a terminal illness, they may not want to prolong their suffering. Just because this prescription is filled does not mean that they have to actually go through with it. Some people just may want that option there if they need it. My second talking point is relief of suffering. Patients diagnosed with a terminal illness may encounter physical, spiritual, and psychological suffering. These patients experience pain, alienation, questioning of beliefs, anger, sadness, and so much more. Caregivers of these patients may also experience suffering and feelings of burnout. By offering an end-of-life option, these individuals can eliminate prolonged suffering for themselves and their family members. So both of these points can tie into one another. As I've already stated, these patients may just want to know that they have this option, but ultimately they may not choose to use it. So I think this bill gives patients a peace of mind and full control of their end-of-life care. So what's the next step for this bill? If it were to go through, I think this bill should move forward and be scheduled for committee consideration. And overall, although I'm passionate about this bill, I do think its slow progress is necessary considering the severity of what this bill would mean to our patients and medical personnel. Thank you.